Congressman, thank you so much for joining us on Zona Politica. How are you, sir?
We're doing okay, and lo siento, mi español es muy mal, and necesito practicar.
Bueno, you have to come on more often then so you can practicar. Congressman Huizenga, thanks for being here. We find that the disapproval of Hispanics, especially young Hispanics, for Obamacare has really increased dramatically in the last quarter of 2013. What do you attribute that to?
Well, Helen, I think mostly that's attributed to what all young people are experiencing. They're experiencing dramatic increases in any kind of health care coverage that they were hoping to have in the costs. And my guess is that it is, whether it's in the Latino community, whether it's in the Anglo community, whether it's in the Chinese community, it doesn't matter. Young people especially are seeing dramatic increases in those costs, and that's what I think is causing them to be well behind where they had the Obama administration had said we needed to be for the enrollees, for the system to work. And
you raise such a good point about youth in particular, no matter where you are, because that's exactly where they need. The young are the ones who are going to pay higher, proportionately speaking, than those who are elderly. And one of the things that you have to note about the Hispanic community is that it's a very young community. The average age in the United States is an astonishing 27 years of age. So these young people who, by nature of youth and not having had the opportunity to work for very long, haven't had the skill sets to be able to have a job that really is as high paying to be able to face these additional costs.
Yeah, one of the things that really struck me is with 65% of Hispanics between the ages of 22 and 35, that is really the sweet spot that the Affordable Care Act, or quote-unquote Obamacare, needs to hit for the system to work. And what they had said before is that they needed 40% of all of the enrollees between the ages of 18 and 34, and currently that number is only at 27%. So we're seeing a huge deficit of the type of people that need to get into the system for it to even work financially.
And of course, there's no question that the Hispanic community is feeling it in a very big way, and they're getting milked in the process. One of the things that you see is that there's 2.3 million Hispanic small business owners are noticing the increase in health care for their employees. And just a few days ago, the Obama administration released a report that's rather explosive. It shows that health care premiums are going to go up for 2/3 of America's small businesses as a result of the Affordable Care Act, or Obamacare.
Yeah, that was quietly released by the administration this past Friday afternoon, and what it says is that 11 million people who work in small businesses are going to see their premiums increase, and that's very disturbing, coupled up with what has happened in many places with the 30-hour work week requirement as being the threshold. We're seeing employers, whether they're in restaurants or construction or service or other places, they're coming in and saying to their employees, I'm sorry, but we're going to have to cut your hours back to 29 per week. And we don't have an answer. We know you'd like to work more. We know you'd like to have the flexibility, whether it's waiting in a restaurant or some of those kinds of things, but they're being handcuffed by the rules. And that's one of the reasons why the Republicans have been exploring and have introduced legislation that would increase that definition back up to 40 hours a week, because we know that would help people out as they're feeling the pinch economically.
Congressman, I'm just going to say a couple of words in Spanish to let people know that I will translate this later. Estamos conversando con el congresista republicano por el segundo distrito del estado de Michigan, Bill Huizenga. Después de la entrevista voy a hacer un resumen de lo que nos dice el congresista. Congressman, I was really stunned when Senator Harry Reid, the leader of the Senate for the Democrats, said that he thought that the ads, he essentially called people who are patients and who have been ill and adversely affected by Obamacare. He said that they were liars. And I was really stunned, because how can you call cancer patients liars when they've had their health insurance cut, when they can't continue the treatment that they have? I'm just absolutely stunned at how cold he can be.
It's very frustrating, and look, we all have friends or family members that are in these very awkward and frustrating times right now. Whether it's a particular medicine that they're on or a particular doctor that they need to go see, and they're having their health care plans come back to them and say, I'm sorry, we've had to cancel you, or we've had to move your doctor. And to discount that, and to discount that concern and that upheaval that people are feeling in their lives, I think is really cold and frankly poor policy as we are trying to deal with people. So look, we all have. There's a lot of heated rhetoric around around Obamacare. I think we all need to sort of step back here a little bit and make sure that we understand how it's affecting people's daily lives. And I think everybody wants to see greater access at lower costs with high quality. My fear is, though, that the way that the bill is written and the law is being implemented, it doesn't do those things. And actions speak louder than words, Helen. And the actions of the White House are they're admitting that it doesn't work. That's why they've had to do all of these delays, and they've had to have these changes that have been put in place. And unfortunately, it's the president just deciding what parts of the law that he signed into law that he's going to implement and execute. And that's not his role. He needs to include the legislature in deciding what parts of the law may need to be changed.
Couldn't agree with you more. Congressman Bill Huizenga of the 2nd District of the State of Michigan. Thank you so much for joining us today, sir.
Muchísimas gracias.
De nada.